Podcasts on UNCTV.org are made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC-TV.
Healthcare reform continues to be at the forefront of the conversation in legislative bodies across the nation. I recently sat down with Duke University Health System President and CEO Dr. Victor Dzau to talk about healthcare issues and needs in our state. Dr. Victor Dzau, welcome to North Carolina Now. You are the Duke University Chancellor for Health Affairs and the President and CEO of Duke University Health System. As you take a look at the healthcare environment today in North Carolina and across the nation, what do you see as our biggest healthcare challenge?
Well, I think we have lots of challenges, but I think the key issue all of us are interested in, from the public to people like myself, is quality, cost, and access. Those are the big three, if you will. And if we can address all of them, then we'll have just great type of healthcare for everybody.
And what do you see as we go into 2011 as being the most significant issues that are going to address those three areas?
Well, there's a lot of activities everywhere now thinking about how we can get prepared for the Affordable Care Act, the one that in fact people call Obamacare. Whether there's a repeal on the constitutionality with regards to does every American have to buy insurance, I think the train's left the station with regards to changing the way we care for patients. So let's talk about quality. There's a lot of initiatives to say how can we improve the quality of healthcare? How do we measure the outcome? Not just simply a transaction between patient coming to see the doctor, but at the end of the day, we want to be sure that we are improving the quality and therefore the outcome of the patient. Secondly, in looking at how to redesign healthcare, this is a catchphrase called care redesign. We want to look at not only does healthcare work for the patient, putting the patient in the center, does it give you the right outcome, but also can you reduce the cost? And I actually believe you can do both of them at the same time, or maybe all three, access as well. But it will require a significant change in the way we do things. And I am very encouraged by the fact that North Carolina, Duke, UNC, Wake Forest, East Carolina, everybody is working very hard in trying to look at care redesign in order to provide best care for our patients with lower cost and having access for everybody.
Let's talk a little bit about your work at Duke. How are some of the ways that you are balancing those three very important areas of quality, cost, and access?
Yeah. So as I said, I think one of the big initiatives that we're putting a huge amount of effort is to look at care redesign, which is let's look at the way today, the way we take care of a patient, let's say with diabetes, and how would we like to redesign the care where putting the patient in the center, putting teams of care providers around the patient, and then looking at what's the most cost-effective way to get the best outcome. And then if a patient's in the hospital and then get discharged back in the community, what is the best transition plan whereby there's follow-up, there's good outcome, where the patient returns back to the community. And Shannon, as we talked about earlier, we at Duke very much believe in providing the care in the community. So we are now creating clinics, urgent care centers, and a variety of other possibilities so the patients don't have to come to the ivory tower, if you will, but in fact they can access Duke level of care in their home. And that's the whole concept of a medical home, the patient-centered medical home.
In August of this past year, you opened up the largest community-based healthcare center with Duke, and it was in a former middle school.
Yes, that's right, yeah.
How are you looking for different places like that to be in the community, and why is that type of outreach important?
Well, first, it's important because we all realize that patient needs to get their care in the most convenient place possible. And that should be either close to their work or close to their home. I mean, nobody wants to travel 30, 40, 50 minutes just to go and see the doctor. So being able to create access points in the community is very important in my mind. Good quality, like easy to get to. Secondly, in many of these clinics, we actually serve many patients who have no insurance. They find very daunting to come to a Duke hospital, or for that matter, I'm sure that some of the major hospitals around here. They feel a lot more comfortable going to closer community clinics. But by providing them with the access point, they get better care, they get better health. And so when the economic challenge of the state, if not the country, hit us, we didn't see a big surge of people using emergency room because they're unemployed, because they all have access already to some of the clinics. So I think one of the most important things is to say we need to provide good health and health care to everybody, however they can get it, as close to their home as possible. Now, with regards to the issue about why we chose these areas, sometimes we do it because we do a lot of interviews, talking to patients. In this case, the mayor said to me, this is where he wants to put a recreation center. But also recently we used an approach called geospatial mapping. Geospatial mapping allows you to take the information, the database, if you will, of every individual that is cared for at Duke, so we can map them at every household. We can take the information on their health status, their environmental factors, whether they have a job, and then we can look at where the closest clinic is. And when areas where you have a high concentration of people with disease, with chronic disease, need for health care, and low level of clinics and provider activity, that's when we're going to put a clinic there. That's how we do it.
At the same time that you're doing this type of community outreach, you are also working internationally with organizations like the National University in Singapore. Mm-hmm. Tell us about that project and that partnership and how it broadens Duke's reach.
Well, first of all, I want to tell you that the Duke Medicine mission statement is to transform medicine locally and globally, and to improve community health and to eliminate health inequalities. I'm very proud of this statement because many academic medical centers talk about the three missions, right? Excellence in patient care, outstanding research, and great in teaching. We believe in all this, but we believe all those three are means to an end, which is making medicine better and different for people. And not only here, but globally, and to eliminate any disparities we can see. With that background, that's why we work so hard, not only in Durham and the Triangle in North Carolina, but we also believe that we need to do that globally. So we created a Global Health Institute when I first came 6.5 years ago, and that institute is providing healthcare and education research everywhere, in poor countries, under-resourced countries. And part of our mission is to not only do service, but service with learning. And so when the Singaporean government came to us a few years ago to say, we heard about your curriculum, we heard about how unique Duke is, can you create American-like school, a Duke curriculum in Singapore as an alternate to the current medical school that they have, which is 100 years old, found by the British? We say, of course. And so we've been there now for about 4 years. We'll be graduating our first class this May, and we're very proud of it because it's been a phenomenal experience in terms of globalization, internationalization, and the fact that we got some of the brightest students from everywhere now being part of Duke.
If our viewers want to learn more about what's happening with Duke on the healthcare front, whether it be in Singapore or here in North Carolina, what do they need to do?
DukeHealth.org.
Great. Dr. Dzau, thank you so much for sharing your time and all your thoughts with us.
Thank you very much indeed.
Podcasts on UNC-TV.org are made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC-TV.